So this goes back to the 1970s when a Scottish surgeon actually and Linus Pauling combined and did some studies in Scotland in patients with end-stage cancers, and they gave both oral and IV ascorbate, vitamin C, and saw some good results. Then in the early 80s, a oncologist at the Mayo Clinic did two randomized trials of a high dose ascorbate, but was always given orally. And he showed no difference. So ascorbate kind of treatment for anything kind of lay dormant for a while. Then in the 90s, Mark Levine at the NIH did some studies looking at the pharmacokinetics of IV versus oral ascorbate, and he showed quite nicely that if you give oral ascorbate or vitamin C, you only get micromolar levels in the blood, and no matter how much you take, that's all you're going to get. However, if you give it IV and you give very large doses, you can get millimolar levels in the blood, and millimolar levels will kill the cancer cells. So, so there was some small studies done with IV ascorbate, and what we're talking about is 75 to 100 grams of IV ascorbate given 2 to 3 times a week. And orally, all you can do is give probably about 500 milligrams a couple times a day, and you still don't get very high levels in the blood. So we started doing some phase 1 trials in like 2008, 2009, and they showed quite nicely that it was safe and tolerable by patients. And there were some other phase 1 trials done in Thomas Jefferson University showing the similar results. And so we started embarking in trials in both pancreatic cancer, glioblastoma, and lung cancers. And we did a randomized trial of pancreatic cancer and IV ascorbate, which has just been published now. It had been shown that they cause DNA damage in killing the cancer cells, but only about 10 to 20% of patients actually have a response to gemcitabine and Abraxane. So it was a randomized trial in patients with stage 4, which is metastatic pancreatic cancer that, no operation or radiation will help. And so we randomized patients that came here to the University of Iowa and Medical College of Wisconsin. In the control arm, they received gemcitabine and Abraxane or Nab-Paclitaxel 3 times a month, every week for 3 times a month. And then in the experimental group, they received the same dose of gemcitabine and Abraxane, and then were given IV ascorbate, 75 grams intravenously 3 times a week. And they were followed until the patients progressed. In the laboratory studies, it is synergistic with gemcitabine. The mechanism of action is it generates hydrogen peroxide. And in tumors, in the extracellular fluid of tumors, there's an increase in hydrogen peroxide. And hydrogen peroxide is what kills the cancer cells. The next steps are hopefully we did a phase 1 where we combined ascorbate with chemo and radiation therapy. We have lung trials that are ongoing that we need to finish, and we have a glioblastoma trial that's also ongoing that has to finish. And hopefully with pancreatic cancer, we need to get somebody who would donate a lot of money so we could do a phase 3 trial.